Death can be messy. All types of things can happen at the end of life. In this video, I'm going to talk to you about what they are, why they're happening, and what you can do about it. If you're not used to being around someone who is bedbound or getting close to the end of life, it may surprise you that it's kind of messy sometimes. I know as a hospice nurse, I always say that death is natural and it's biological and our bodies are built to do it, and that is all true. And there are some things that happen that can surprise people if you're not ready for them. Things like people being incontinent of bowel and bladder and their family having to change them at the end of life. Things like throwing up, or stomach bile coming out of the mouth or the nose. All of these things are normal, but unexpected at times. So let's talk about why it's happening and all the things you can do to prepare for this. Number one, incontinence. Incontinence will always happen at the end of life. If someone is dying a natural death on hospice and they're dying a gradual death, which is normal on hospice, they will eventually be incontinent. And you, as a family member, if you are caring for them in your home, will be the one who has to change them. And generally speaking, you have to change them while they're lying in bed. All of this can be hard, it can be shocking, and the hospice company is there to help you teach you how to do it. I also have a video on this page on how to do it, how to change someone while they're lying in bed, if that helps. This video is just about normalizing the fact that they will be having bowel movements and they will be urinating, and likely you will be the one that has to change them. Another shocking thing that can happen at the end of life is right when someone dies, they may have a bowel movement and urinate. So even though they are gone, you now have to change them. That happens because at the end of life, with that final breath, that final release, a lot of times people will right? Their whole body lets everything go. That includes sometimes making a bowel movement and urinating. Now, a lot of times when I come as the hospice nurse who is declaring someone dead after the family has called, I will try to clean them up the best I can if I've noticed that they've definitely had a bowel movement or urinated. Sometimes we may have to ask the family to help us just because the person can be heavy, but please know that this is all normal and to be expected. The way to prepare for these things is to have gloves, wipes, and bed pads available. Now, all of these things can be given to you by the hospice company when your loved one is admitted into hospice. If this is before hospice, you can find these online, CVS, any kind of general store. They usually do carry things like this. Now, let's talk about your loved one either throwing up or having something that kind of looks like throw up, but it's green, it's black, it's yellow. It can be really, really shocking. This is usually stomach bile. Stomach bile can be green, it can be black, it can be yellow, kind of foamy. Why does this happen? So it doesn't happen with everybody. This video is not meant to scare you like this will always happen to everyone who's at the end of life. That is not true. This is just something that can happen possibly. A lot of times I see it with people who have GI cancers, so like anything with the bowel, the stomach. If tumors are somewhere in the abdomen and they're blocking something, that can make your loved one more susceptible to having, nausea and vomiting, throwing up, or having bile kind of regurge after they have died. So what does this generally look like? This can look like someone has thrown up all black fluid or green fluid or foamy fluid. Sometimes it's a lot. Sometimes it's a little. And again, most of the time you don't see anything. It can be shocking and scary and gross, for lack of a better word, and then plus it's your loved one, so it's really hard to witness. This is happening because we have all of these sphincters in our body that keep fluid that really was helpful for us at one time, right? It's really helpful to have gastric fluid in our stomach to help break down food and do things to keep our body running. Now, at the end of life, we don't need to use that anymore, and our sphincters a lot of times relax. Like I said, you die, you take that last breath, and everything relaxes. And sometimes when that happens, bile will come up, right? Come up through the mouth, and then our ears, nose, and throat are all connected. So sometimes it can come through the nose. I wouldn't say many people do this, but some people at the end of life do this. And I think it's important for families to know that this can be normal and it's not necessarily hurting your loved one. It just looks bad and it's part of our human body kind of just coming up out of the mouth because our sphincters are now relaxed. So what can you do about it? One, just know it's normal. That's the first thing. Know that this can be normal. Two, again, always have like gloves and wipes around your loved ones so you can clean them up if you need to. Of course, you can always call your hospice company. If this is happening before they die and they are awake and alert and this is happening, 100% call your hospice company. We need to fix that. We can't have your loved one throwing up bile all the time. That can be very uncomfortable. There are things we can do about that. We can try medications, we can try repositioning. Just make sure you work with your hospice company if that's happening to your loved one while they are on service. Every once in a while, you might also see blood, right? See blood on their gums, or their mouth seems bloody, maybe a little blood mixed in with saliva. All of that can be normal as well. Specifically, if someone has something wrong with their liver, they can bleed a little more easy, so their gums can be bloody, or they can bruise really easy. All of that is normal, specifically with anyone that has liver involvement. Also, they just have a dry mouth. They haven't been getting great oral care, which is all very normal. So sometimes you can see things like that. Now, again, with someone with liver disease, they sometimes may have something called esophageal varices, basically like outpouchings in the esophagus that can burst. I have never seen it, truly. I actually haven't seen it as a hospice nurse, but it is something that can happen. And if they do burst, it will create a lot of blood, and it could be a lot of blood coming from their mouth. As hospice companies, if we know someone has esophageal varices, we will instruct the family to have dark towels in the home, right? So like maroon towels, black towels, because if this does happen, it can be scary and it can be messy. And to clean up blood on a white towel is even more disturbing. So we always say have dark towels around, call the hospice company the second you see anything like this, and basically we will help you take care of it. You have to sit your loved one up. Many times they will be close to death if this is happening. So it's a matter of just trying to keep them as clean and as comfortable as possible. This isn't meant to scare you. It's meant to educate you about the messier, harder sides of death and what you can do to help your loved ones if you think you're going to be in this category. Generally speaking, the main things that I see as a hospice nurse are incontinence, right? Cleaning up someone's bowel and bladder. That is the common messy part of death and dying. These other things I'm talking about, I wouldn't say are normal, but they can happen, like I said. A lot of times I see them with patients who have any kind of liver disease or metastatic cancer to the liver, patients who have gastric cancers or bowel cancers, any kind of tumors that may be blocking bowels or are blocking other areas that are making it harder for the person to have bowel movements, or they've had consistent nausea and vomiting, things like that. So again, it's not a common thing, but it is something that can happen, and it's something to be aware of. The biggest thing you can take home is to call and talk to your hospice company. I think preparation is key. Just knowing these things can happen can help decrease that fear if you do start seeing these, and just normalizing all parts of end of life. End of life is a very natural part of life, just like birth. Birth is this beautiful, beautiful thing that comes along with a lot of stuff that we don't talk about, right? There is pooping and pain and some blood and fluids that come along with birth. That is also how it can be at the end of life. So knowing that, preparing yourself, and kind of normalizing all of it will just help you, like I always say, live better and die better.